hungry. So this is what misfire shots that I have most of my surgeries there. Now, this is one case. See, I am a trigger hungry. I want to just put the lens and look what I've done. This was the first lens of Rayner hydrophobic lens I was using, and there it is. And after that, I must have used only one of them. See there, I put the lens in the bag. Somehow I was lucky, but then there was a PCR. But thankfully, that lens stayed on, and you can see the rupture there. You can see. And look at this. This is a similar lens that I put in. I thought the lens is there in place, but after 1 month, I see the lens is slowly sliding. Actually, I had not put it in the bag. It was a small pupil, so I was in a hurry to finish off the case. I didn't check it whether it has gone in the bag, but gradually it slided. So later on, I just had to go and put it back in the bag. Well, this is one more misfire. Look at this. I go and then look at this. The lens has got stuck, and they're stuck. I'm trying to take it. I'm in a hurry. Let's see. There, the lens. I'm trying to take it out and see the lens haptic has gone. And hearing from Dr. Amar, I've seen his conference. I didn't have a PCR, so I thought that let me use this scaffold technique. Try this scaffold technique here before I, master myself. So there I put the lens there. So I explained myself that I want to cut the lens, so I needed to protect the posterior capsule, and that is how I just took out the lens, made myself happy. There, the lens is there in place. So another misfire. Now, what is this misfire? There, I'm putting the lens, and look at this. I'm not aware, and the lens is going to the area of my friend Dr. Rupak was there. So I thought, no, I can't share the booty with him. So let me take the lens out. Let me not give it to him, his area. So there I rotate it, reposition it, get it on over the lens and there over the iris, and then rotate it, put it on the sulcus, round it, and then the other haptic also goes in the sulcus. And my day was saved because I went for an IOL capture, and that is it. But end of the day, the lens was well placed nicely. But look at this. This is again similar crime I had committed. I thought that I put the lens, and there the lens was halfway in the vitreous. And this time this patient came to me a month later, and it was already fibrous. Look at this. So I just tried to get it, and the other haptic was there. It is stuck. So again, I go in the similar way, try to rotate it, get it in anterior chamber, reposition it on the anterior chamber, and then I wanted to look for that area where I'll put the gap between the anterior capsule and the iris, but it was already stuck there. So I wanted to separate it, and then this area I couldn't separate. I just had to use an MVR blade to separate the iris from the anterior capsule. And once I've done that, I rotate it, then again in the same way, put it over the sulcus and there, and then going for the IOL capture. The lens is there, and look at this. What is this? Suddenly this patient comes to me after 7 years after surgery. I see 2 lenses. When did I put 2 lenses? Actually, that was a history of trauma, and the lens had gone down and it was dislocated, and it had left an impression. The lens was there for 10 years in those lenses. So once my VR surgeon friend got it out in anterior chamber, gave it to me, I just had to take it out and put the multi-piece lens. That's the best thing, because I had already opened the, I thought that I might need to do a SFIOL. So the multi-piece lens goes in the sulcus, and then I need to just capture it and keep it. But this is a repeat misfire. Again, look at this. The lens goes like a missile. Yes, there it is, a missile, and I didn't know what has happened. It looked like there was a PCR there. Is there a PCR? I can see a lot of folds, a lot of broken capsule, and over it, I thought, okay, I'll escape. That part is still there. Let me dial this lens and put it in the bag. Those capsular rupture, whatever it is, and somehow the lens will do, because I didn't have a second lens also. Once I put the lens inside and put this one, and then I realized, well, come on, where is the rupture? I don't see the rupture. What happened? What had happened? When I put visco there, everything looked okay, fine. Then why this folds and rupture there? And then I realized actually I had, the zonule had given up, and that had folded on and that come there. So now what do I do? I just rotate it. I thought that I can put the haptic there, and then I put the CTR there. The CTR goes in the bag. There with the second hand, I try to direct it. Once the CTR is there, then I see, yes, there are a little bit of vitreous that are popping out. So all I need to do is put a bit of triamcinolone, do a vitrectomy, and take those vitreous that is there out. Once that is done, the lens is well centered, nice. Continue the vitrectomy round pupil, and that has made my day. But this is something which has really gone haywire. Look at this. This was a femto, uneventful femto. I had done it, and once I've done that, I'm going for IA, and there I catch hold of the posterior capsule. And this was a eye-hands lens, one of those early lenses that somehow I put a visco plug, put the lens there immediately. Well, this was done, absolutely done, well-centered lens. I had no problem. I just pulled pilocarpine, end of the surgery. Patient goes back to the bed, and then suddenly I realize, what have I done? Instead of putting a 26 diopter, I put in 16 diopter lens because there was the earlier patient that was waiting. So the people already get it back, and we said that, well, we have to do some procedure again, something is left. So again, this pilocarponize, put in adrenaline, put in visco, and then so again, with the help of visco, and I thought that I should try the IOL scaffold. I thought, no, I can't try too much of things. So I just cut the lens, took it out, put again visco there, put the lens, there the lens goes in, well in the bag. So all is well, that ends well, and it was a great thing to bear myself in front of it. It's a trigger to trigger happy phaco surgeons who would like to, at the first instance, put the lens without thinking like me. Thank you, Shurji.